At the start of the press conference, we will hear from the speakers, and after that, we'll take questions from journalists in this room and via Zoom. And for those of you on Zoom, we have German and English translation today. As you can see, we have with us today Dr. Tedros, WHO Director General, Minister of Health of Germany, Jens Spahn. We have Dr. Mike Ryan at the end, Executive Director, WHO Emergencies Program. And next to me, Dr. Chikwe Ihekweazu, Dr. Chikwe, Director General of the Nigeria Center for Disease Control, who will be joining as WHO's, as the hub's inaugural director in a couple of months. Dr. Tedros, you have the floor.
Thank you, Gabi. Good afternoon, everyone, and thank you for joining us today. I would like to start with a brief update on the global situation. Last week, the number of COVID-19 cases and deaths reported to WHO declined for the first time in more than 2 months. This is obviously very welcome, but it doesn't mean much. Around the world, many countries are still seeing steep increase in cases and deaths. And around the world, we still see shocking inequities in access to vaccines. More than 5 billion vaccines have now been administered globally, and almost 75% of them have been in just 10 countries. In low-income countries, most of which are in Africa, less than 2% of the adults are fully vaccinated, compared with almost 50% in high-income countries. Some countries are now rolling out booster doses to fully vaccinated people, when millions of people around the world have not even received their first dose. That's why I have called for a moratorium on boosters, at least until the end of this month, to allow those countries that are furthest behind to catch up. Third, doses may be necessary for the most at-risk populations where there is evidence of waning immunity against severe disease and death, such as the very small group of immunocompromised people who did not respond sufficiently to their initial doses or are no longer producing antibodies. But for now, we do not want to see widespread use of boosters for healthy people who are fully vaccinated. Last week, I issued a statement with the heads of the International Monetary Fund, the World Bank, the World Trade Organization, calling for 4 things. First, we call on countries that have contracted high volumes of vaccines to swap near-term delivery schedules with COVAX and the African Vaccine Acquisition Trust, or AVAT. Second, we call on vaccine manufacturers to immediately prioritize and fulfill their contracts or to COVAX and AVAT, and to provide regular, clear supply forecasts. Third, we urge the G7 and all those sharing countries to fulfill their pledge urgently, as barely 10% of nearly 900 million committed doses have so far been shipped. And fourth, we call on all countries to eliminate export restrictions and any other trade barriers on COVID-19 vaccines and the inputs involved in their production. Even as we respond to the pandemic, we must learn the lessons it's teaching us. One of the most clear is the need for new, powerful systems and tools for global surveillance to collect, analyze, and disseminate data on outbreaks with the potential to become epidemics and pandemics. Viruses must move fast, but data can move even faster. With the right information, countries and communities can stay ahead of emerging risks and save lives. Urbanization, deforestation, climate change, and intensified agricultural practices are all increasing the risks of zoonosis spilling over into human populations. At the same time, new technologies are giving us the ability to predict, prevent, detect, and respond to outbreaks faster than ever before. Harnessing the power of these new technologies to save lives is not just an opportunity, it is an obligation. That's why that's what the WHO Hub for Pandemic and Epidemic Intelligence is all about: leveraging innovation in data science, harnessing the power of artificial intelligence, quantum computing, and other cutting-edge technologies, and fostering greater sharing of data and information between communities and countries. No single institution or nation can do this alone. That's why we have coined the term collaborative intelligence to sum up our collective mission. This hub will bring together scientists, innovators, policymakers, and civil society representatives from around the world to work across borders and disciplines. Of course, the ultimate goal is not just to develop new toys, it's to save lives. Our aim is to put the knowledge and insights that are developed here in Berlin to practical use on the ground all over the world. As you know, there have been several reviews of the global response to the pandemic with recommendations for countries and for WHO about what we can do to keep the world safer in future. This hub is one response to those recommendations, filling a gap in the world's defenses and answering the question that Chancellor Merkel asked in 2015. How can we react faster and avoid the needless suffering and death of the COVID-19 pandemic in future? For WHO, this is part of our commitment to keeping the world safer, to being the organization the world needs, and to giving countries the information and tools they need to protect their people. To lead the hub, I have appointed Dr. Chikwe Ikwezu, who is currently the Director General of Nigeria's Center for Disease Control, and he brings a wealth of experience and will serve a dual role as head of the hub here in Berlin and as Assistant Director General for Health Emergency Intelligence in Geneva. Berlin is the perfect place to host the WHO Hub as a vibrant, dynamic, creative, and modern city. That's the ideal incubator for what we want to achieve. My thanks once again to Governing Mayor Muller and the people of Berlin for hosting the WHO Hub, and to the federal government for its generous financial support. Today, I also had the great honor of presenting Chancellor Merkel with the WHO Global Leadership Award in recognition of her outstanding contribution to global health over many years. Health has been a central theme of the Chancellor's leadership throughout her tenure, from the G8 summit in 2007 to the address to the World Health Assembly in 2015, to the G20 summit in Hamburg in 2017, and to Germany's leadership during the COVID-19 pandemic. They say that in a crisis, you really find out why your friends are. And in the past year, WHO has had no better friend than Germany. When the COVID-19 pandemic struck, the German government moved quickly to expand its financial support for WHO, becoming our biggest donor, and was one of the first supporters of the Access to COVID-19 Tools Accelerator. I'd like to use this opportunity to thank His Excellency, the Minister Jens Spahn. In October last year, I was honored to speak to Chancellor Merkel, which is when we first discussed the idea for a new center that would serve as a global platform to enhance a global capacity for pandemic and epidemic intelligence. So it's a very proud moment for me today to open the WHO Hub for Pandemic and Epidemic Intelligence with Chancellor Merkel and Minister Spahn. But as I said in my remarks earlier, her legacy will be so much more than her name on a plaque on a wall in Berlin. It will be a legacy etched in the lives of people all over the world for years to come. who live healthier, safer lives because of her work. I thank you and like to pass to Minister Spahn.
Shall I? Yes. Tedros, Chikwe, dear Mike, ladies and gentlemen, for many, many years now, I would even say it has become a good tradition. Germany is committed to global health and to be engaged in global health, not just financially, but politically and in the institutions that shape global health politics worldwide. And that is why, by the way, from the beginning of this pandemic, we have put the WHO and its work and its engagement at the core of the answer of the international community. And that is why we have donated and will donate as the second biggest contributor to COVAX. We know that no one is safe until everyone is safe. That is why we will donate more, or why we will donate up to 100 million doses of vaccines until the end of this year alone to the world through COVAX and bilaterally. And this is why, by the way, we are supporting German companies like BioNTech to cooperate with other companies worldwide. And I really do appreciate the commitment of BioNTech Pfizer to build up production capacities in Africa in cooperation with South Africa, Senegal, and Rwanda. Today, with the inauguration of the WHO Hub for Pandemic and Epidemic Intelligence, there's another step, and we are doing nothing less than setting the direction for a world safer from upcoming pandemics in the future. The learning process from the current pandemic is still ongoing, obviously on a national level and internationally, but one thing is totally clear already. To effectively prevent future pandemics, we need more transparency, more real-time data sharing, and experiences at all levels from different sectors. And Micah and I, we just discussed the Ebola cases in Côte d'Ivoire these days, the suspicion that was there, and just by sharing samples, in short time, it was possible to really know what's going on. And that's just another concrete example, recent example of how important it is. So we need a globally networked surveillance, data analysis and research, and therefore we need this hub. We must build a global genomic and epidemiological program combining current and new forms of expertise at the global, regional and country level with a stronger WHO at its center. Global health security cannot be reached without a strong WHO as the lead agency for global health and pandemic preparedness. And I said again, and I keep advocating for it for months now, WHO as an international institution can only be as good as national states, the member states, let it be. We need to give it the financial resources it needs to meet actually the expectations that are there. And we need to give the transparency and the data that is needed to really make a difference. And so again, I already did it, but once again, I call on China to finally become fully cooperative and to make the examination of the origin of the SARS-CoV-2 virus transparent to the international community. That's important to learn for future pandemics. The founding of the WHO Hub is a milestone for global health security, and it is an honor for us to have it here in Berlin. It distinguishes our strong German support of the WHO and the successful work of the Berlin-based RKI, the Robert Koch Institute, in the fight against pandemics. There could not have been a better location for the hub than Berlin's basic tech, innovation, and startup scene. Central players in global health are already based here with branches. Beside the Robert Koch Institute and the Charité, there is meanwhile the Wellcome Trust, the Bill and Melinda Gates Foundation, the London School of Hygiene and Tropical Medicine, or the World Health Summit, to name just a few who are now here present in Berlin. And that shows actually that Berlin, step by step, becomes a global hub for global health. I'm proud that with the German support to the WHO hub, with up to 30 million euros per year, we are substantively improving and reshaping the global landscape for pandemic preparedness. But the WHO has not only found an excellent location, but also an excellent specialist with Chikwe to manage the hub. And I remember very well my visit to Ajuba in 2019 it was, and I was very much impressed by the work of the Nigerian CDC and what he has built up there, set up there. And so I just can wish you all the success. Welcome to Berlin. We're looking for a close cooperation.
Thank you, sir.
Thank you, Minister. And now I'm going to call on Mike Ryan, Dr. Mike Ryan, to speak, please.
Thanks, Gabby. And I'll try and just keep my remarks as brief as possible. Thank you, Jens. I said previously in the auditorium, I spent most of my professional life working with many of the people that were in that room and others around the world, and trying to protect people from epidemics and other health emergencies. It's my experience that with three really important, critical things to be effective in response. We must be ready, we must be fast, and we must be agile. We need to be able to predict, prepare, and plan for what may happen. We must be able to detect, assess, and react to what is happening around us, the earliest possible signal of an event. And then we must be able to adapt quickly to the realities of an evolving event, which is never exactly what you plan for or expect. The better we prepare, the more ready we are to respond. The faster we identify new infectious disease risks, the faster we can respond. The more adaptable and agile we are, the more effective our response will be. None of this is possible without better data, analytics, and insights to improve the speed and adaptability of our response. Bernard Schwarzlander, our great friend, will depart WHO's ship soon, said in the auditorium, and I think it was very prescient that probably the only thing that moves faster than viruses is data. And if we want to get ahead of the viruses, we can use that advantage. The WHO Hub embodies and embraces the world of ubiquitous data, the extraordinary accessibility of computing power, and the ultra-connected global population in which information spreads even faster than diseases. And there is no better place to think about doing this than in Berlin, which in itself has become a platform and a hub for collaboration in this space. Questions for us are, how do we link all of the data that's currently available? I think, again, Bernard said, it's not an absence or lack of data we have, it's our ability to connect the dots and connect that data to make meaningful insights in real time to understand what's happening around us in the biologic world. How do we create new ways to analyze the vastness of that data and the multidisciplinary data from different sectors, linking lab data, biologic data, genetic data, social data, behavioral data, operational data, logistics data? It's only by looking at all of these data that we can gain an insight into what's happening dynamically within our populations and how our populations are reacting to the presence of disease. And how can we make the insights we generate available so that decision makers like Minister Spahn and others can make better, faster decisions, both nationally and globally? In short, how do we turn what on the face of it is our greatest weakness? In many senses, it is our very interconnectedness that has allowed disease, viruses, and misinformation to spread. But that interconnectedness is also our greatest strength, our connectedness that allows us to collaborate, to innovate, to share data, insights, to share innovations and solutions. These are the essential questions we hope that the WHO Hub will address here in Berlin and with partners all around the world. It will help develop state-of-the-art analytic tools and predictive models, and hopefully will take us to a new level in our ability to collect and analyze even more complex data. It will link communities of practice around the world to enable better data access and data sharing. And this is crucial. This isn't just about technology in Berlin. This is about linking communities of practice all around the world, with Berlin acting as a magnet for the best minds in the world, physically and virtually. This will lead to better decisions and better outcomes for the people we all serve in the face of epidemic and pandemic threats to come. It is a big task. There is no one better qualified to do that than my friend Dr. Chikwe. We've worked together in different forms over the last 20 years, and it's a great pleasure for me personally to welcome him to our family, and also with a great sense of excitement of what we may achieve in the future. Thank you.
Thank you, Mike. And on that note, I'd like to invite Dr. Chikwe to say a few words.
Thank you, DG. Thank you, Minister Spahn. And thanks, Mike. Our role is to translate a grand vision by the DG and Chancellor Merkel into reality over the next few months and years ahead. Our work is cut out for us. We will get down to work very soon. We'll look for the best possible team from within WHO and outside, from our partners, member states, stakeholders, to this exciting city to deliver on this vision. We will work hard to deliver both the best science and using the best public tools, public health tools available, and there are lots of them out there. And we deliver it in a way to have the greatest impact on public health. Ultimately, that's what we want to do. We want to enable our political leaders have the data, the information, the insights they need to make very tough decisions for the world ahead of us. So we look forward to building a very collaborative space. And not just a space, but a new way of working for all of us in global health. Trust is a word that has been used a lot today. You can't build trust when you don't work with each other. So we'll bring people together, learn to work with each other, and maybe demonstrate a path to enable the world have an opportunity to hopefully prevent, if we can prevent, detect in sufficient time the new pandemic in order to prevent what has happened this time from happening again. It's a big challenge, but I think together and with the operational world being collaborative, we can work towards delivering on this vision that our leaders have asked us to deliver on. So I look forward to exciting new life in Berlin over the next few months. I look forward to delivering on this vision together with all the colleagues, both within and outside the organization, from this part of the world, from the global south, and from everyone that has something to contribute to the vision that we have created and shared today. Thank you very much.
Thank you, Dr. Chikwe. We have a bit of time for questions. I'm going to start in the room, and my only request is that you state your name and the name of your news outlet when you ask your question, and that you aim to ask questions relevant to the new hub and pandemic preparedness and response, if at all possible. So I think you have to go to the microphone, but yes, please do ask.
Yes, hello. Can you hear me?
Yeah.
Yes.
My name is Tonia Mastrobuoni. I'm correspondent for the Italian newspaper La Repubblica. I have a question for you all, because this pandemic has been basically about lack of information, about withholding information, about lack of transparency, ab origo, from China. So how do you think that this hub can in future prevent such things? Because this is a more political issue, also about regimes controlling science, controlling universities and so on. So how do you think that this hub can help to prevent such an event again? Thank you.
Minister, would you like to tackle that? Mike?
I can, yeah. I think that's a rather narrow characterization of the situation we've all faced over the last year and a half. I point you to the fact that the first diagnostic tests were developed here in Germany based on a full genome sequence that was posted by China on the web. And that was what was used here at Charité University by Christian Drosten and his superb team and commercialized here. And in that time between that sequence been put on the web, we had laboratory assays by January 14th. We were engaged in commercialization of the test by January 23rd, and by February the 4th, millions of tests were going around the world. No response is perfect, but to characterize something as a total lack of transparency is, I think, extreme. There are many excellent scientists and excellent scientific collaborations that are ongoing with our colleagues here, our colleagues in WHO, colleagues around the world, and with scientific colleagues in China. It's for others to answer the geopolitical issues around this issue. But certainly, all countries need to look at how we share information. All countries need to look at the speed at which we share that information with others. There are some lessons to learn around that. But I think it would be to mischaracterize the situation to single out that specific issue. Because, as I said, a good deal of the response and a good deal of our early understanding of this disease, its clinical impact, its epidemiologic impact, the basic parameters of this disease in terms of its or not, in terms of its clinical characterization, the definition of the disease itself. Much of that data came from the frontline workers in China and then in other countries who sacrificed a lot to save lives. So I think we should be balanced, I hope, in our characterization of how we look at the issue of transparency. It's a relative concept. There are criticisms to be seen in every sector when it comes to that word. Trust and transparency are difficult concepts, but yes, we can all improve in that, and all countries can improve in that.
I just want to shortly add something. First of all, we have seen both from China too. You just mentioned, I think the genome was even published open data like via Twitter. So that was sharing information. But at the same time, we are still figuring out and not sure how. Where did it come from? Where's the origin? And there are at least some hurdles to examine that. Most likely it is a zoonosis, but it's not totally unlikely that there are other origins too. And to learn for future pandemics, we just need to know how it happened. And to approach it more general, the question, of course, I myself asked myself several times, if it had started in Germany or a European country in the US, how would we have cooperated with the WHO? Because, of course, there are so many dimensions to it. Politics, prestige, science. But still, we are now discussing the new pandemic treaty as a part of the WHO construction. And that what I really do believe in, that we need real commitments of all member states and all those who want to sign this treaty, that they are fully transparent in the case of an outbreak, for example. And like the WTO has sanctions if a member state is not fulfilling the commitments, WHO not really has one. So if there is a member state not cooperating in a way it actually should and committed itself by joining it or in a treaty we are discussing now, there must be something that follows. That is not an easy debate, but I think it is a necessary debate.
Thank you, Minister. Thanks, Mike. Unless somebody else wants to jump in, we will take another question from the room. Kai Kupferschmidt.
So I guess I don't need to introduce myself.
No, Science Magazine.
I wanted to ask really two related questions about the hub. So as far as I can see, there's two issues, right? There's the question of data that needs to be generated because it's not there. We all know there's a lot of inequities in the world, and one is in terms of pathogen surveillance. There are countries that don't have a functioning system. So will the hub address that, and how? And then the other question goes back to the question from earlier, which is really, we do know, I was talking to Jeremy Farrar yesterday, who said he thinks we're in a very dangerous situation at the moment in the world, because a lot of the surveillance that we're used to actually at the moment, that the world is essentially blind at the moment to, for instance, what is happening in China. A lot of collaborations have stopped. So how do you address that in the hub? How do we make sure, given all the disincentives that we've seen also in this pandemic, how do we make sure that more data is generated and that that data is shared openly across borders, even if it's occasionally not in the interest of the country sharing it?
Thanks, Kai. Minister Spahn?
Well, just actually, again, I just, first of all, in general, can say it's a commitment to join a World Health Organization. It's a commitment to join international organizations. And if you join it, it comes with the necessity to fulfill the commitment. Otherwise, these organizations can't work. The second thing is just to focus on science. This hub should not at all become political. It must be just science-based. And again, we need to try at least to get all member states with all their differences, different political systems, different beliefs, whatever, values, we need to get them all in through science and to always get back to science and the science base of the work. Yeah, that's actually where, just on a personal base, I mean, that is the important work too. If there is a personal base, if there is a network, then there is trust growing. And trust is what you need in times of crisis. And so this is really a starting point, but you are absolutely right. This needs to develop and especially develop through personal connection.
And maybe I could just supplement, because I think you identify a very specific and important issue. There's a lot of discussions going on now globally around global governance of the future of emergency preparedness and response, global financing, and then global systems and tools. And there is a danger, and I think we may be alluding to this, that we believe that these global solutions and goods are the absolute salvation and solution for what are essentially local issues in many countries. Local lack of capacity, lack of workforce, lack of investment in basic primary health care and public health infrastructure in countries. Watched a documentary recently. I don't know why I never realized this in my life, that you build a suspension bridge, you have to build it from both sides at the same time. You can't finish a suspension bridge from one side. So I do think we need global collaboration and global solutions and global tools and global governance and all these other things. But we also must begin locally as well, because the best defense against pathogens is an unbreakable chain of defense that's built around connecting local capacities, communities of practice. And this hub will seek to do both. It will seek to do both by leveraging off both. It will leverage the communities of practice around the world, building that capacity and including and being inclusive and decreasing the barriers. If you think about this in terms of what are the biggest barriers to innovation, very often it's just accessing data. Researchers in developing countries, there's a massive cost of doing business. There are huge barriers to engaging in predictive analytics and supercomputing because there are physical and infrastructural barriers to that collaboration. The Berlin Hub will seek to do that, to bring and level that playing field. But it will also bring that global innovation and the best minds in the world to deliver solutions for local systems. So where the global goes to local, local goes to global, when the two meet, we will have something, I think, that will be very special. And I think we have to recognize that our biggest gap, and if I had to be honest, I'd say to you, what's our biggest gap right now? And it is those holes in the system. And they're not political holes. I mean, yes, there are issues sometimes around transparency and reporting, but the holes in our system aren't those holes primarily. The holes in our system are lack of infrastructure, lack of frontline data collection, lack of laboratory capacity in the front line. They're the real holes in the system. So we need to be very careful in a sense that we have to address, as Jens said, some of these geopolitical issues and some of these issues around trust and transparency. They're real, but they're not the only holes in the system. They're not the only reasons for silence. The reasons for silence and much of global surveillance is absence of signal. There is no signal because there's no system to detect. It's an echo chamber. So maybe Chikwe would want to reflect on his experience in Nigeria and other places on how you build local capacity and how maybe the Berlin Hub can seek to leverage off that. Chikwe, I don't know if you wish to make a comment at this point.
Thanks, Mike. Maybe a very quick one. in addition to all that you've said, and all of that is right, there are actually also many systems that exist. They just exist in small pockets, in small countries, and they're not connected to anyone else. So one of the first things we'll be doing is looking at those systems and seeing what actually is out there, what innovation has happened in many countries that we now need to bring into the mainstream. And the second thing is, we mustn't ever fall into the trap of looking at systems, data systems, only as systems that push data upwards. Every system has to provide local value to communities, local value to states, countries, cities, to make local decisions before or in parallel with sending them up for global decisions. And so as long as we can develop these systems together with colleagues, enable it to deliver a local value to whatever level it's needed for local decision-making, then we would have already started in a very good place towards providing global health security. There'll never be global health security if we don't ensure local health protection. And these are the systems we need to build now to do both.
Thank you. I think this is very important, Kai, and very glad to come to your beautiful city, huh? In person. Another round. We met, of course, before in person. On the Berlin hub, the WHO hub, one of the things we're saying is it will be collaborative intelligence. And if you say collaborative intelligence, then it should be based on trust. So the issue is, how do you build trust? And to build trust from WHO side, what we're saying is we will focus on science, we will focus on solidarity, and we will focus on solutions. And we hope member states and other partners will understand this and then move toward this cooperation, openness, and transparency. With openness, transparency, we can save lives, but without transparency, when transparency lacks, we can lose lives. So I think the global community should really understand that when sharing of data is compromised, it has implications in terms of lives, in terms of suffering. So that's the basics, and we will push, and this is not about, even if you find anything in any country, it's not finger pointing, or it's not going to be blaming, but to find out what happened and to control the situation and also learn for the future. But as Minister Spahn said, okay, you can do through collaboration and you can say collaborative intelligence and so on, but that may not work. So what do you do when it fails? When there is no collaboration, what do you do is the question I think our colleague also from Italy asked. Then there could be some kind of sanction. Maybe that's one thing that people are now discussing. As part of the pandemic treaty, for instance, to have all the incentives or the carrots, but maybe exploring the sanctions may be important. And I hope our member states will take this seriously and discuss. But taking you back to science, solidarity, and solutions, when you center your belief on science, solidarity, and solutions, and you stick to it, you avoid political debates. And I can give you one example. Italy reported early cases of COVID. And we asked them, okay, if you have early cases of COVID, that's from November 2019. We said, please send us the data. And they shared without any problem. And then we said, okay, share the sample with a lab we selected in the United Kingdom for verification. Then they agreed and sent the sample for retesting and confirmatory test to the UK. And the results, Italian lab got and the British lab got is different. So now they're engaged in scientific debate and no political debate. Because there is no political debate, the world actually doesn't understand that there is a scientific debate going on COVID between Italy and UK. So that's what we're saying. If countries are cooperative, then if they focus on science and solutions, on evidence, then the debate will be scientific, not political. Even the origin study, the reason it's politicized is because access to data and information is not as you would expect. There is a problem. So in order to make it a scientific debate, we have to share data. And that's what we are asking, by the way, to China. Please share data. And also we need to keep the lab option open. And let's, based on science, let's have a look. But the cooperation is lacking. And instead of scientific debate, then you see political debate. So the best way to get out of political debate is just make it science and give data. Then how can this play a role? Of course, just what I said, but it may help us in moving forward on more collaborative intelligence, cooperation, in building trust. But still, there may be areas that we may need to consider, because I don't think this will address all the problems that we have. Thank you.
Thank you, Dr. Tedros. Thank you to the minister, to Dr. Ryan, to Dr. Chikwe. We've run out of time. I want to thank all the journalists here in the room and on Zoom. And we look forward to engaging with you at our next press conference. Thank you so much.